Now let's bring in Dr. Steven Sample. He's a doctor out of Indiana, an emergency physician at Memorial Hospital and Healthcare Center in Jasper. Dr. Sample, my apologies. My mouth and my brain are not in line today. We've checked in periodically with you over the past 7-8 months, and you've given us a realistic picture of what's been going on the ground where you are. Last time we spoke, you said things were getting better. How is it today?
Hi, Katie. Yeah, it's way worse now. It's like you could almost have predicted it. I remember when I first came on with you back early in the year, we had 0 cases and we were terrified that it was coming. But certainly it's here now. And more concerningly, we are seeing numbers like we have never seen before on the week of a national holiday where everybody likes to get together and eat a bunch. Our tertiary care centers in the surrounding big cities where we send our sickest patients are starting to fill. They're starting to go on diversion, which leaves us potentially in a really hard place coming up over the next month or so. Because if I don't have any place to send my sickest patients, my cardiac bypass patients, my dialysis patients, I don't know what we're going to do with them.
Well, let me ask you about that, because we were just talking about it a moment ago. That happened here in New York City, where cardiac arrest patients, paramedics were told not to bring them to the hospital if they couldn't revive them. There just wasn't any space to try and help them in the hospital. Are you worried about a similar sort of thing happening in Indiana?
I'm worried about that similar thing happening everywhere. We've gotten to watch these cities burn kind of one by one. My buddy is down in El Paso right now in the thick of things, and he's pretty miserable, it sounds like. And this can happen anywhere. And I think that the hardest part for people to realize is that it happens really quickly. You know, you can go from busy to a little bit underwater to completely unsustainable in the period of just a few days to a week, you know, because we've only got so many beds. And when they start to come, they come all at once.
You, in our pre-interview with you told us that you were worried about some people out there who don't really believe in the virus, also not believing that they need to get a vaccine. Talk to me about that concern, because that's alarming.
Sure. Well, and I think that goes to both sides of the political aisle right now. We're seeing people who are very hesitant on this vaccine. Certainly, we have had a lot of damage done to the perceived credibility of our national organizations like the CDC and the World Health Organization and the FDA. So there's a lot of people out here who believe that this just can't possibly happen this fast. They don't understand the technology that behind it, but it is going to be our way out of this. If the numbers that Pfizer and Moderna are reporting are even within the ballpark, this will be a game changer if we get the right amount of people to take it. If it only goes in 40% of arms, we don't get herd immunity. You know, so we really have to start a national education plan from the level of each individual doctor to their patients, and we need to have that talk now.
I know everyone knows this. It is very easy to lose trust and very difficult to earn it back. Dr. Steven Sample, thank you so much for joining us today.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.